Hi everybody, welcome to the video today. I'm going to give you lots of tips to help you prepare for a theatre interview. You might be a registered nurse or an operating department practitioner, an ODP, applying for this role. I'll include key background reading to help you prepare for generic and scenario-based interview questions. Hope you find it helpful. Don't forget to give me a thumbs up on YouTube if you do. So my first key tip is to systematically prepare and research before your interview. You need to think about what type of background research, what do I need to research before the interview? And I'll give you lots of tips in this talk. You need to also prepare for the type of interview. Is it a straightforward face-to-face interview, an interview with a panel? Does it include group discussion, or is it a value-based interview where you need to prepare some good practical examples? There'll always be generic interview questions that everyone can prepare for. How do you plan to answer the first question, for example? Why have you applied for this theatre role or to work for this employer? And if you can answer your first question well, it gives you confidence. And I'll give you some tips on what other topics and interview questions you can prepare for. It's normal to feel nervous before your interview, but preparing before your interview will really help those nerves too. So there's some key areas to research before your interview, and you can do this systematically. So the first thing is to think about, what does this role entail and which setting am I working in? If we think about a patient's journey through theatres, we call this the peri-operative period, and it's subdivided into 3 stages: pre-operative, operative and post-operative, or before, during and after surgery. Think about, where are you going to be working? Is this theatre role across several areas, such as anaesthetic and an operating room, or is it based in just one theatre area, such as the recovery unit? Knowing which area and the type of role indicates some of the questions you might be asked. If you apply for a scrub practitioner or an operating theatre practitioner, you might be asked about keeping instruments sterile. If it's a recovery role, questions might link to escalation of a deteriorating patient. If it's an anaesthetic role, it might be about medications. So how do you find out what the role entails and what are you going to be dealing with in theatres? Start by going through the job description, and it should state if you're based in one area, or the expectation might be that you work across all areas. It will also give you lots of tips about potential questions. You might see key headings such as teamwork. It's good to make a note of key terms and headings, as you might be asked about those at interview. You can never guarantee what you're going to be asked, but it does help. You can also book an informal visit to the area and talk through the main responsibilities of the role or any challenges in the role with staff who work there. Again, this can help you with answering future questions, and it can also, an informal visit might be a reason why you applied, and you should always say that you went on an informal visit if you did, because it shows that you're proactive. And you might say that you were impressed by the teamwork, or that you saw that staff were very motivated and happy at work. If you can't arrange an informal visit, don't worry. Employers understand that you might live quite far away and just not be able to arrange it in time before the interview. So you can talk to managers on the phone, talk to clinical educators. You might just watch a recruitment video. Part of doing your background research includes reviewing national websites, looking at NHS career sites. The NHS careers in theatres talks about different roles, for example. You might also network with theatre staff on nursing Facebook forums. We've got some really good UK Facebook forums for nursing. If you throw a question out, usually you get a really good constructive answer back. Always check the employer website as well. You might be asked, what do you know? A question might be, what do you know about us as an employer? And look at what's their mission statement. If it's an NHS trust, they might have visions or values. And you can also give this as a reason for choosing to apply to this trust if you feel the values align with yours. You might also be asked questions on these values. So for example, if compassionate care is top of the list, they may ask you to give an example where you provided compassionate care over the last year. Similarly, we have the 6 C's, and these are a set of national values for all health and social care staff, and lots of interviewers question staff on these values, and they're going to be similar to employer values. The 6 C's are compassion, care, competence, communication, courage and commitment. And you may be asked to name one of these values, one of the 6 C's, or asked to talk through how you uphold one of these values, linking it to a practical example. It's also important as part of your background reading to revise key terms, policies, procedures and standards relating to the role as part of your preparation for interview questions. So key terms linking to your research. Words like evidence-based practice. It's very easy to go blank in an interview, for example. What does evidence-based practice or evidence-based care mean? And I know people that have gone blank in an interview when they did know the answer, but under pressure they forgot. Evidence-based practice is just about using best evidence when we make decisions about the care of an individual. We've got evidence-based care plans, standards, policies are underpinned by an evidence base. And if you don't revise these terms, you might go blank. And try and think about it in your own words. Another classic is forgetting what the word evaluation means, or quality. How do we evaluate care? How do we measure quality care? And again, the best way to evaluate quality care is through patient feedback, talking to a patient. Another way is observing and physiological changes, psychologically, and seeing if a patient's getting better. So if they have a wound, is the wound getting better, for example? We also use local audits to evaluate standards of care. And I have several simple short videos if you need revision in any of these areas, such as quality, some of the key terms that you would use, quality improvement, quality assurance, clinical incident reporting, risk management in healthcare, just to revise some of those terms. So they might be quite helpful. So do check those out on my YouTube channel. Along with key terms, you also need to think about local, national policies and standards relating to the role. These standards and policies are often mentioned in job descriptions, or they might be part of an answer to a question. In theatres, key areas I would suggest you look at are consent and mental capacity assessment. Does that person have capacity to consent? Incident reporting and escalation is another one, because you may have patients that deteriorate. Infection control, which includes sterilisation methods. You might be asked about how to ensure surgical equipment and instruments stay sterile, for example. And then medications is another one that includes storage of medication, medication administration. What do you do if controlled drugs go missing? Again, that would link to escalation. What's the usual dose of a medication? And if you don't know the answer, the key here to any questions to do with consent or infection or medication, if you weren't quite sure, be honest and say what the interviewer wants to know is that you're safe, that you are going to adhere to an escalation procedure, national policy, medication, adhere to the medication procedure. So if you don't know, you would go and check with the pharmacist, check it in the British National Formulary. If you're unsure about anything, you would adhere to the procedures and the standards. So checking out the policies, as I said, for consent, medication, mental capacity assessment, incident reporting and escalation and medication are very helpful. It's also helpful to look at the World Health Organization surgical safety checklist. And that checklist is used globally, and it aims to decrease errors and adverse events during the perioperative period. So it's used during all 3 stages: preoperative, operative and postoperative. And you might be asked about checks on arrival to theatre, for example. So again, that's a good checklist to revise. The next area for your background research is to look into the different people that you're going to be working with across the theatre team members and roles. Employers sometimes have slightly different job titles, but there's going to be support worker roles such as theatre receptionists, porters, operating department orderlies, healthcare assistants, assistant practitioners and nursing associates. Then you've got registered professionals such as registered nurse, operating department practitioner, ODP, scrub practitioner, theatre practitioner. And then specialist roles, do they have roles such as surgical care practitioner? And then you've got senior roles such as team leader, theatre manager. And I've got some simple videos that explain the differences between these roles, such as an assistant practitioner and a nursing associate, and the difference between those roles and support worker or registered nurse and ODP roles. So you might find those helpful if you get questions regarding delegation and scenario-based questions. So they might be quite helpful just as a bit of revision. It's also very helpful to prepare some practical examples before any interview that demonstrate your key attributes, skills, knowledge. And one example might cover lots of key areas. It might link to teamwork, compassionate care, overcoming a challenge. But having some of those examples prepared means that you don't have to worry in an interview and try and think about those examples. If you are a near to registering student or ODP, look back on your placement, in your placements and in class work as well. You could look at group work that you've delivered or a presentation or education. So it's helpful. Sometimes you might be asked a question to give an example of good team working, or you could use an example to expand on one of your answers to another type of question. One key tip, when you're presenting a practical example, try and keep it concise, stick to the facts so you're not repeating yourself, and also talk about the impact that you had. So sometimes people will give an example, but it's something they've observed and they weren't really part of the scenario. They didn't have any actions, they just watched what went on. It's much better to give an example where you had some actions and you did something in that scenario, that practical example. And another tip is to state the impact. In Driscoll's reflective model, that's called the so what. So an example might be that you facilitated a patient discharge last year and it went really well. You collaborated with family, you overcame lots of difficulties to get this patient home. So the so what would be, well, what was that impact? Well, obviously you got the patient home, which is amazing, but it might be that the patient didn't have to have another night in hospital. They might have made their daughter's wedding. You were able to take more patients for surgery. Rather than just describing how you discharged them, stating some facts that you got them home quicker than they would have gone home, for example. But it's just giving the impact of what you do gives you more points in interview. And it's those little extras that set you apart from other candidates. If it was overcoming a challenge, what learning did you have? And what did you do with that learning? How did it change your practice in the future? It's just giving those sort of little extras, really. Before I go through some example generic questions, you also need to be clear on the type of interview that you're having. And if you're unsure, check with the recruitment lead. Is it a face-to-face standard panel interview? Is it a virtual interview? Is it a value-based or group interview? So for example, in a value-based interview, the interviewers want to see that you align to the values of the employer, and you need to prepare some good practical example linked to their values. One example might link to all the values, but do that preparation before the interview. If you have a group discussion or group work, I also have lots of tips in my YouTube video, tips for a group nursing interview that ODPs could use as well. Always make sure you know which location you are needing to get to and arrive on time. Check location and check internet links if it's a virtual interview. Try and use a desktop computer or a tablet if it's a virtual interview, because that's stable. You're not going to, you can place it in front of you rather than holding your phone. If you don't have a tablet or a desktop and you need to use your phone, you've got to try and stop the phone moving around and don't just hold it in your hand, because you need to concentrate on your answers. And also it's quite distracting for an interviewer if your head keeps moving around. So try and prop your phone on a stand if you can, or on some books. If you the other thing to say is to try and do the virtual interview in a quiet room so you can concentrate. And you also want to check on your internet connections maybe beforehand, so that the interview doesn't need to be cancelled. If the interview does need to be cancelled, try and cancel as early as possible. And you know, if you've had an emergency, that they usually interviewers will give you another interview. They're not obliged necessarily. If you don't let them know before the interview, they may not, but you know, quite often if you can let them know as soon as possible, they will let you be interviewed the next day. So as with any interview, it's helpful to think through how you're going to answer some core generic questions about any role. Tell me a bit about yourself. Why have you applied for this theatre role? What do you know about the role you've applied for? What do you know about us as an employer? There's some classic questions. And you never know what they're going to ask you, but you're probably going to have some questions about the role, the employer, or the skills required in the role. And all the previous background research you should see now aligns to the answers. So think about how are you going to structure an answer if they ask you, tell me a bit about yourself, or why do you want to go for this role? This is a very open question. So you'll need to talk through your key past experience, types of surgery and procedures that you've assisted with, academic courses. If you've got no theatre experience, just summarise relevant previous experience and courses and transferable skills. When you have a question like, why have you applied for this role? You could include things like previous theatre experience as a student, an informal visit. It may have been a recruitment video, talking to theatre nurses, ODPs, watching recruitment, an employer video. Think about what interests you about this particular theatre role. Have you got a passion for theatres, or is it just that you want to try the role as you enjoy acute care and caring for surgical patients? You can be honest. Do they offer excellent preceptorship and support when you're first registered? Is it a reputable large hospital trust that's going to offer career opportunities? It's going to be, the answer is going to be individualised to you and what you feel. And if you've done some research, it shows that you know what the role entails, you know about them as an employer. Often interviews will also pose some sort of question about skills required in the role. So what core values and skills do you think this role entails, or do you what skills and values do you have that align to this role? So having looked through the job description and doing all the background research, that will help you. Also, some questions sometimes about the team, the structure, delegating questions. You might be given a scenario. How would you delegate to different people in this scenario? And as I said, my previous slides will help on that, relating to different roles in theatres, for example. You might also have interview questions, as I mentioned earlier, linked to practical examples. So what does compassionate care mean to you? Can you give me an example where you provided quality care or evidence-based care? And as I said earlier, try to choose an example that had an impact and that your actions influenced the situation rather than something you observed others doing. We also might have questions in those areas linked to specifically to a scenario in theatres, or more general, such as how do we assure quality standards are maintained in theatres? And often these sort of questions are asked for deputy team leader roles, for example. And there's lots of different ways to answer a broad question like that. It should involve good teamwork, communication across teams is paramount, as mistakes can be made in theatres due to poor communication, which will reduce the quality of care. And you could talk about local, national standards. You could give the World Health Organization surgical safety checklist as an example that aims to decrease errors and adverse events through preoperative, operative and post-operative period, or use other relevant standards and procedures linked to infection control. You know, there's lots of different ways to answer this, using audits and other types of evaluative reviews. But think about how you would answer sort of questions if you're going for a more senior position linked to evidence-based care, quality standards. Tell me about a time when you worked well in a team, or that you made a difference to patient or families. And if you're more, it's more senior role, it might be across the team. And talk me through a challenge that you've dealt with and how you overcame that challenge and what you've learned. So having those key examples is really helpful for these sort of questions. Some other classic questions: what are your strengths? And that's going to be personal to you. A recent practical example that demonstrates your strengths is good to hear. What areas are you most worried about? What do you think you'll need the most support with? So be honest and talk through how, you know, the areas that you're worried about, but also how you mitigate for those weaker areas. What are you working on? How would you overcome those areas? So, for example, if you're worried about your knowledge base, you would then counteract that with, but I'm looking forward to doing my e-learning post-registration courses that will help increase my lack of knowledge, for example. How do you manage stress at work? Again, you need to demonstrate that you've got an awareness when you're getting stressed at work and how you would manage it through asking for support with your workload, talking through with an experienced practitioner, for example, and your workload might need to be further like delegated out, but you always ask for support. And they might ask you about a current healthcare topic as well, and how do you keep yourself up to date. Good topics currently, I would say, are digital health, robotics and artificial intelligence used in theatres now or in the future. So if they ask you what was the last thing you read, how do you keep up to date, have a look at some digital health. There's lots going on, and especially in theatres as well, so that's a good topic to look at. Sometimes you'll have a scenario-based question, and what would you do if you had a deteriorating patient? An example might be somebody with hypertension, hypervolemic shock, deteriorating conscious level, and it's going to link to monitoring, observations, escalation, and that's why I said it's very helpful to review escalation procedures and structures. You could have a scenario on something to do with consent. A patient says they want to withdraw their consent when they arrive in theatre reception. What would you do? And this links to consent procedures and also escalation. And you may be asked a question linked to mental capacity assessment too. So do check that on your background research. Visualizing scenarios sometimes really helps. I have to sometimes to think, well, what would I actually do if the patient's in front of me? What would I do in that situation? And most people would assess the situation. You'd use a compassionate approach, your listening skills, establish why this person has changed their mind using a kind approach. You're not coercing them in any way. And an interviewer wants to know that you're non-judgmental, that you're going to be safe, adhere to procedure. You can escalate to the team according to procedures, but you're also recording the incident, and it's through good communication, information giving. You're finding out what the issue is with this patient. You know, why are they saying they don't want to go for surgery? And it might be some miscommunication. And with some more information from you or from the surgeon, they may agree to have that operation, or they may not. They can make an informed choice if they have mental capacity. So they have a right to refuse the operation right up to, going into the reception and prior to receiving their anaesthetic. So it's just being kind, using informed consent procedures, and adhering to the standard, the WHO checklist, surgical checklist. And then what would you do? Another question might be something to do with missing instruments is a classic for theatre in surgery. And again, there should be standard operating procedures for surgical counts, double checking, counting, escalating, referring to surgeons, anaesthetists. You need to escalate to theatre manager, coordinator. There may be x-rays to check in the patient, and record keeping, incident reporting. So it's adhering to those standards again, and you might have other questions linked to maintaining a sterile field or sterilisation methods, for example. And what would you do if you saw 2 new trainee nursing associates trying to reposition a patient incorrectly? This might not just be theatres, it could be anywhere, but they're not adhering to manual handling procedure. And because it's trainee nursing associates that are new, I would be thinking, assessing this situation, first of all, you're wanting to stop them hurting themselves. So telling them to stop immediately would be what you should be doing, as they could cause an injury to their backs. Explaining, using constructive feedback, and then talking to them, finding out what training they had. And it might not be their fault. They might have not completed their manual handling training and nobody told them. So you need to establish a reason. So it's using that sort of nursing process of assessing the situation and then planning what you're going to do. Once you've established the reason, you can implement your plan. You might need to escalate to an education lead, and how many other trainee nursing associates or ODPs have not been informed that they must complete manual handling, for example, and that they need to complete their ELA. So it might link to education and the management. So you're looking at the whole picture to decrease risk. The key here is to keep the patient safe and then make sure they don't hurt themselves. Escalation, instant forms. So these sort of scenario questions, and as I said earlier, the preparation on standards and procedures will help you with any sort of escalation, these sort of types of questions. So hopefully with all my tips, you'll do well in your interview, but there is potential that you might not be offered a role. So what do you do if you're not? I would always suggest that you are polite and you ask for verbal feedback. You may have the chance to apply again, and it's helpful to learn from that interview feedback. Ask the interviewer, what areas or questions could I have improved on? What were my weaker answers? So you can do some research on those areas in the future. It might be that you did excellent in interview, but someone else just did better and there's only one post. And if there is opportunities to apply again, then do. Check when you can apply again and when there'll be future opportunities, and thank the interviewer for the opportunity. So I hope you found it all helpful. Do check out all my other videos on my YouTube channel, and good luck in your interviews. If you have any questions, do put them in the YouTube comments. If you prefer to DM me privately, you can DM me on Twitter or my website. And if you are interested, I'm an author of 2 books, How to Thrive as a Newly Registered Nurse and How to Prepare for Interviews and Develop Your Career as a Nurse or Midwife. I'm sorry, I'm not an ODP for any ODPs out there, but there's lots of tips in there that would be helpful as well to ODPs actually. But any nurses that are interested, there's links to my books in the YouTube description. Okay, so good luck all of you.